Do you know the difference between Sildenafil and Tadalafil, better known as Viagra and Cialis? Today, that's exactly what we're going to talk about. I'm Dr. Freya Parkar-Blake, urology and men's health expert, and here I cover everything related to men's sexual health, performance, and overall vitality. If you like what you hear, don't forget to subscribe and share this channel with your friends so they can benefit too. Now, before we talk about how these medications work, it's important to understand what actually happens when you get an erection. The very first component is arousal. That can come from what you see, smell, hear, feel, or even imagine. This arousal signals your body to release nitric oxide. And nitric oxide is like the ignition switch for erections. Without it, nothing happens. So, in order to get an erection, you need both arousal and nitric oxide release. Once that nitric oxide is released, your body produces chemical messengers, the most important being cyclic GMP or cGMP. This messenger relaxes the smooth muscle inside the penis, allowing blood to flow in. At the same time, the veins are compressed so blood can't easily leave, creating rigidity and firmness. Now, what ends the erection? There are three main factors. First, arousal fades and nitric oxide release stops. Second, cGMP starts to break down naturally. And third, after ejaculation, the nervous system sends signals that cause the smooth muscle to contract again, forcing blood out of the penis and back into circulation, leaving the penis flaccid. Here's where erectile dysfunction medications come in. All of them work by preventing the breakdown of cGMP. They block an enzyme called phosphodiesterase, specifically PDE5. This prolongs the action of cGMP, allowing stronger and longer erections in response to arousal. Before we get into the differences between Viagra and Cialis, it's important to understand that these medications do share some common side effects. These include headache, facial flushing, nasal congestion, heartburn, and sometimes changes in vision. But there's one critical safety warning. If you are taking nitrates, medications like nitroglycerin for chest pain or angina, you absolutely cannot use these erectile dysfunction drugs. Taking them together can cause your blood pressure to drop dangerously low, even to the point of death. There are also certain medications that can interact, and if you have kidney or liver problems, you may need dose adjustments. That's why it's so important to only use these medications under medical supervision. You may even come across so-called supplements online that are secretly laced with sildenafil or tadalafil. These are dangerous because you won't know how much you're taking and they can cause serious harm. There are also some rare but serious risks associated with these drugs. One is priapism, an erection lasting longer than 4 hours. Contrary to what some men might think, this is not a good thing. Erections that last too long can actually damage penile tissue permanently, causing scarring and future erectile dysfunction. If it ever happens, it's an emergency and needs immediate treatment. Fortunately, this is very rare when medications are taken appropriately and usually only occurs if someone overdoses. Another extremely rare side effect is sudden hearing loss. I've never seen it in practice, but it has been reported. As for effectiveness, both Viagra and Cialis have success rates in the range of 60–80%. They are roughly equivalent in terms of how well they work. The main reasons we discuss these two specifically is that, at least in the US, they are the most affordable and widely available generic options. Let's start with Sildenafil, the generic form of Viagra. The origin story is actually fascinating. Sildenafil was originally developed as a blood pressure medication. During the early clinical trials, researchers found it wasn't doing much for hypertension, but patients began reporting stronger, firmer erections. That's how Viagra was born. Silden is the oldest of the PDE5 inhibitors, so it has the longest track record of safety and efficacy. When you take Viagra, it needs to be taken about 30 minutes to an hour before sexual activity. Here's an important tip. It works best on an empty stomach. If you've just had a heavy, high-fat meal, the absorption slows down and it won't be as effective. Once absorbed, sildenafil typically lasts about 4 hours in the bloodstream. It comes in doses ranging from 25 to 100 milligrams, but it's only approved for what we call on-demand use, meaning you take it when you anticipate sexual activity, not daily. Now, sildenafil does have some side effects that are more unique to it compared to other ED drugs. Some men experience a blue-green tint in their vision or changes in color perception. If that happens, you need to stop the medication and consult your doctor. Another less common side effect is nosebleeds, though again, that's relatively rare. Now, let's talk about tadalafil, better known as Cialis. Tadalafil is more selective in the enzyme it targets, which may explain some of its differences. It was released in 2003, so it hasn't been around quite as long as Silden, but it has solid data supporting it. Tadal also needs to be taken 30 minutes to an hour before sex. However, unlike sildenafil, it lasts much longer, up to 36 hours. That's why it's sometimes called the weekend pill. With tadalafil, you can take a dose on Friday night and still have effectiveness through Sunday. Another big difference is that tadalafil is available in both on-demand dosing and daily low-dose regimens. Daily dosing, usually 2.5 to 5 milligrams, allows men to have spontaneity. They don't have to plan intimacy around a pill. They can simply take it every day and be ready whenever the moment is right. Cialis also has another unique benefit. It's approved for use in men with benign prostatic hyperplasia, or BPH. That means if you have urinary symptoms like difficulty emptying your bladder, urgency, frequency, or waking at night to urinate, and you also have erectile dysfunction, tadalafil can treat both problems at once. Another point, there is some evidence that tadalafil may be more effective in men with severe erectile dysfunction, those who don't get erections at all compared to sildenafil. So which one is better? So which one really comes out on top, sildenafil or tadalafil? To answer that, I looked at a meta-analysis. And if you're new here, meta-analyses are my favorite type of research. They gather all the available studies on a subject, pull the data, and analyze it systematically. This makes the findings much stronger than relying on just a single trial. In this particular meta-analysis, researchers reviewed 16 studies that directly compared sildenafil and tadalafil, including more than 5,000 men. They only included studies that used validated erectile dysfunction questionnaires, not just did it feel better, but scientifically reliable measures of erection quality. Here's what they found. In terms of pure efficacy, both drugs performed about the same, but there were differences in other important areas. Men taking tadalafil tended to report higher self-esteem, better relationship satisfaction, and greater confidence. Their partners also reported more satisfaction compared to those whose partners took sildenafil. In 9 of the studies, men and their partners were asked which medication they preferred. The clear majority chose tadalafil. Why? Likely because of its longer duration and the option of daily dosing, which allows for more spontaneity and less planning around sex. Side effects were similar overall, but with some differences. Men on sildenafil were more likely to report visual disturbances, while men on tadalafil were slightly more likely to experience muscle aches. Both of these side effects were relatively uncommon. So here's my recommendation. If you have urinary symptoms from BPH along with erectile dysfunction, tadalafil is an excellent first choice, especially the low daily dose. If you only want on-demand dosing, you can try either medication. If one doesn't work well for you, it's reasonable to switch to the other because individual responses vary. But always use these medications under medical supervision to avoid dangerous drug interactions or complications. And remember, medications aren't the only option. Other treatments include vacuum erection devices, urethral suppositories, penile injections, and even penile implants in advanced cases. The right choice depends on your specific situation and your goals. Finally, while sildenafil and tadalafil can help you achieve erections by preserving cGMP, they don't fix the root causes of poor vascular health. That's why I always emphasize lifestyle, regular exercise, heart-healthy nutrition, stress reduction, and sleep. These are the foundations for long-term erectile function. And for men who really want to take things further, I want to be upfront about something important. I see too many guys wasting money on unproven, unsafe supplements they find on adult websites, and sometimes those can even be harmful. That's exactly why I only recommend 2 carefully selected options that I know are safe, backed by science, and actually work. You'll find the links to both in the comments and video description below. The first is for men who just want a moderate, clean boost. It's simply organic watermelon extract rich in L-citrulline. This amino acid is converted by your body into nitric oxide, the key molecule that relaxes blood vessels and drives healthy blood flow. Better circulation means firmer, more reliable erections naturally. But if you're a man who wants a much bigger transformation, not just a slight boost, but a noticeable improvement in hardness, stamina, and overall vitality, then I recommend the advanced formula. It combines L-citrulline with powerful performance herbs and nutrients. Icarian, horny goat, used for centuries to improve circulation, hardness, and stamina. Tongkat Ali, which boosts testosterone and sex drive while reducing fatigue. Fenugreek, shown in studies to increase libido, energy, and orgasm intensity. Nettle root, which supports healthy testosterone levels, prostate health, and stronger erections. This combination doesn't just help with blood flow. It addresses the full picture of male performance, hormones, energy, stamina, libido, and even prostate function. It's a comprehensive solution designed for men who want to feel like their best selves again. So, if you're ready to take action, start with the option that fits your needs. The links are right below in the comments and video description. Thank you for watching, and take care of.